morning, friends. This is a demonstration of IAOS Mega MAHT. This is a 540 ml vacuum thinner bottle and has a stainless steel diffuser rod and a silicone stopper. The bottle has three markings: a plus mark for putting ozone, a small circle for inserting of heparin, and a large circle for insertion of the drip set. A 5 ml syringe is taken, and here we use 1000 ml, 1000 international units per ml of heparin. So we have extracted the heparin. We take 3.5 ml of heparin, that is about 3500 international units, and this goes to the bottle. The balance 1.5 will be used to prime the set. We push the syringe through the small circle, and because the vacuum, the heparin is sucked into the bottle. While removing, must hold the needle and remove it. We must not remove the syringe, else the vacuum will go away. Now, the remaining 1.5 ml of the heparin is extracted into the syringe and is diluted in 5 ml of water for injection or distilled water. This will be used to prime the syringe and prime the drip set, and also the butterfly and the bivalve. So from the lower lock end of the set, diluted heparin is put so that the entire interior of the drip set is lined. A bivalve is opened. A bivalve is connected to the transfusion set. The bivalve is also primed with a few drops of heparin solution, diluted, and then we adjust the bivalve so that the flow is straight from the donor vein into the vacuum thinner bottle. An 18 or 19 gauge Renflon is taken, and again the diluted heparin is added here to ensure that it is well primed, and then we close the transfusion set. This is to ensure that we do not accidentally lose the vacuum. Now we are ready for venipuncture. A tourniquet is applied. This is a venous tourniquet that will not prohibit the arterial blood from coming in. We anticipate or expect to take about 200 ml of blood, and a butterfly is good enough. The vein is located, the butterfly is put in place, and once the blood is seen in the cannula, the bulb is inserted into the big circle of the bottle and the vacuum thinner opened so that The bottle starts getting filled in. The butterfly is pasted with a paper tape. Here we are using 1/16 of 1/16 ml per minute. Switch 9 in the new machine, iOS Mark 9 machine, which will produce 125 microgram per ml of ozone. So we are giving 60 to 75,000 micrograms in a single MAHT, single pass MAHT, which is one of the new revolutions that iOS has recently introduced. And you can see the procedure described clearly here. So at 1/16 of an ml per minute, the syringe fills a little slowly, but 60 ml of syringe will have 7,500 microgram per ml of ozone. So two syringes together will have 15,000 micrograms per ml. Two syringes together with 125 micrograms per ml will constitute 15,000 micrograms in total, which is only a part of the dose. The same dose will be repeated 3 or 4 more times for 60 to 75,000 micrograms of ozonization. We will be extracting 250 ml of blood, which can take in close to 100,000 micrograms of ozone. Once the two syringes are linked together, a needle is attached to the third part of the bivalve, which is bent and then is bent to 90 degrees. The same is now pushed into the plus mark. We have speeded up and then slowed down the actual process of ozone getting sucked into the bottle. Once it goes in, the ozone gets right down through the diffuser to the bottle, and you can see the ozone bubbling beautifully. The bottle is inverted, the tourniquet is released, the syringes are removed, and this is left as an air vent. The blood flow is now started and the ozonized blood starts going into the body. The bivalve or three-way is removed and we start filling the syringes again to now diffuse the blood through the bottle. We get the bivalve in one line to prevent the opposite side backflow, attach it to a needle, and this needle is pushed through the bottle where heparin was initially introduced. This is closed. 60 ml of 125 micrograms percent is 7,500 micrograms, and we start extracting further 60 ml syringes with 125 microgram per ml, making 7,500 micrograms per syringe. So, if we are injecting 10 syringes, we will be giving 75,000 micrograms. If you are injecting 8 syringes, we will be giving 60,000 micrograms. The bivalve is into the blood. So this is not a surface diffusion, but it is a gentle, slow, gradual bubbling of the ozone into the blood. As each syringe is filled up, the bivalve is opened, and the ozone is bubbled in. A slight rock is given to the bottle. We don't churn or make a milkshake of it. And machine remains on. We are keeping on adding ozone. Unlike the multipass where the bottle has to be emptied and filled in again repeatedly, tilted one way or the other, here we have to just put the blood in and redo it again. You can see the color of the blood turning cherry red each time. One more syringe goes in. This procedure of adding more and more syringes and increasing amounts of ozone is continued depending upon the amount of blood originally extracted in the bottle. In the IOS molecular therapy book, you will find complete details about the maximum amount of ozone that can be bubbled into the blood without causing platelet agglutination or RBC cremation. So as you can see, 6 to 8 syringes of ozone have been given here. After every bubbling of ozone, a very gentle shake is given so that the blood can be seen turning cherry red. We can see the octagonal bubble structure of the ozonized blood with the froth and foam on the top. For details of how this procedure is done, please message me in WhatsApp. We can see here that the blood is almost fully drained. We wait till the column of blood reaches to the level of the heart of the patient, beyond which blood will not flow in. After this, we have to put a tight bandage and in a last of last, with an instruction to the patient that she or he should not remove the bandage for at least 4 hours, because we have used heparin and we do not want any bleeding to occur if the bandage is accidentally removed before the stipulated interval. The process of tight wadding and bandaging is being shown here. The bivalve at the end of the set has been attached for a specific reason, that if by any reason accidental air column enters the transfusion set, one can use the bivalve to close the blood going into the patient's body and extract the air. So a tight pressure is maintained, the patient is comfortable throughout, and this is another subject, a doctor himself, and these two small clips are shown to display how additional ozone is bubbled after the initial ozone has been bubbled. And you can see how the ozonization makes the blood red, and this is the state of the bubbles in the bottle at the end of the therapy. Those interested in details of this can message me in WhatsApp at 97910 20615. Thank you very much for your kind attention. Thank you.